Your nails are not just dead keratin sitting at the end of your fingers. They are fed continuously by the same capillary blood supply that feeds your heart, your liver, your kidneys, and your lungs. Think of your nails like the warning radium light on a car dashboard. When that light comes on, the problem is not the light. The problem is under the hood. The nail is simply where the internal disruption becomes visible. There is even a name for this in clinical dermatology. The nail unit, the matrix, the bed, the fold, acts as what researchers call a keratin mirror, which is a reflection of what is happening systemically inside. Now here is why this matters specifically after 60. A 2024 study published in the Journal of Cosmetic Dermatology found that nail changes were present in 88% of older adults, compared to just 39% in younger controls. 88%. That means the overwhelming majority of people watching this video right now have at least one nail change already. The question is not whether your nails have changed. The question is, what is the change telling you, but you keep ignoring? That is what we are going to answer right now, sign by sign. Sign number 1, clubbing. Look at the tip of your finger from the side. Does the nail curve downward? Does the fingertip look rounder, almost bulbous, compared to how it used to look? That is clubbing. And here is the mechanism. When your lungs or your heart are not delivering enough oxygen to the peripheral tissues, your body responds by increasing blood flow to the fingertips. Over time, that chronic low oxygen signal, what medicine calls tissue hypoxia, causes the soft tissue under the nail to thicken and expand. The nail follows. It curves, it bulges and clubs. Think of it like a slow flood beneath the nail bed. The tissue swells from the inside out. A 2024 clinical dermatology review study of 272 systemic disease patients found clubbing was the most common nail change, present in 35.5% of all patients with active systemic disease. Heart failure, pulmonary fibrosis, chronic lung disease, which are diseases not to consider lightly at any cost. Not cosmetic. Not aging. A signal from your cardiovascular and respiratory system that something has been struggling quietly for a long time. Sign number 2, spoon nails. This one has a clinical name, koilonychia, meaning nails that curve inward instead of outward. Place a drop of water on your nail. If it sits there without rolling off, your nail has developed a concave shape. That is koilonychia. The mechanism is straightforward but overlooked. Iron is not just for energy. Iron is essential for the keratin synthesis that gives your nail plate its structural integrity. When iron is chronically depleted, and in adults over 60, iron deficiency is far more common than most doctors check for, the nail plate loses its arch. It flattens. Then it scoops. That nail is telling you your blood is starving for iron. Not dramatically, not suddenly. Quietly over months. The JAAD, Journal of the American Academy of Dermatology, confirmed the direct link between koilonychia and iron deficiency anemia in their 2025 review. The functional consequence, if you miss this, is progressive fatigue, breathlessness on stairs, and muscle weakness that gets blamed on age. It is not age. It is iron. Sign number 3, Terry's nails. This is one of the most important signs on this entire list. Look at your nails. Are they mostly white, with just a narrow strip of darker pink or brown at the very tip? Not pale, not faded. White, like the nail bed has lost its color almost entirely. That pattern has a name, Terry's nails. And in 1954, Dr. Richard Terry documented something extraordinary. He examined 100 patients with liver cirrhosis. 82 of them had this exact nail pattern. 82 out of 100. The reason the nail turns white is altered blood vessel distribution in the nail bed. When the liver is under chronic stress, whether from cirrhosis, early-stage liver disease, or heart failure, the tiny capillaries in the nail bed redistribute. The nail bed loses its normal pink vascularity. It goes white. A 2011 landmark paper in the American Journal of Medicine confirmed Terry's nails as a visible marker of cirrhosis, congestive heart failure, and chronic kidney disease. This is not a skin condition. This is your liver or your heart or your kidneys begging for help. Through your fingernails. Sign number 4, Lindsay's nails. also called half-and-half nails. The proximal half closest to your hand is white. The distal half, the tip, is reddish-brown. A sharp line divides them, like two different nails fused together. The mechanism is specific to kidney function. When the kidneys begin to fail, a condition called uremia, meaning waste products accumulate in the blood, melanin deposits increase in the distal nail bed. Combined with the proximal leukonychia caused by altered albumin and protein levels, you get the half-and-half patterns. Research published in PMC, the National Institutes of Health Archive, found Lindsay's nails in 10 to 40% of patients with chronic renal disease. 10 to 40%. That is not a rare finding. That is a common finding that is being missed because it is being called aging. Before we continue, the full research list for everything covered today is linked in the description below. Every study, every institution, check them yourself. That is what this channel is built on. Sign number 5, nail pitting. Small dents, like someone pressed a pin into the surface of the nail repeatedly. You may have assumed it was damage, dryness, weak nails. It is none of those things. Nail pitting is caused by a disruption in the nail matrix, the growth center of the nail. When inflammatory cells invade the matrix, as they do in psoriatic arthritis, autoimmune thyroid disease, and certain connective tissue disorders, the surface of the nail grows unevenly. It pits. The nail is showing you that your immune system is misfiring. Systemically, not just on the surface. A 2025 review in Science Direct confirmed pitting as a primary marker of inflammatory nail matrix disease, most commonly psoriasis and psoriatic arthritis, both of which are significantly underdiagnosed in adults over 65. If your joints ache and your nails pit, that combination deserves a conversation with your doctor. Not a topical cream. A honest conversation. Sign number 6, splinter hemorrhages. Pay great attention here. This is the one I flagged earlier. Look carefully at your nails. Do you see thin dark lines like tiny splinters running vertically under the nail surface? Not on the nails. Under it. Most people who see this assume they caught their nail on something, a rough edge, a drawer. And sometimes that is exactly what it is. But when splinter hemorrhages appear on multiple nails, without any trauma, that changes everything. Here is the mechanism. These dark lines are caused by microhemorrhages in the nail bed capillaries. In older adults, when they appear without injury, they are often caused by embolic phenomena. Tiny clots or inflammatory particles traveling through the bloodstream, lodging in the small vessels beneath the nail. The same process that lodges particles in the nail bed can lodge them in the heart valves. A landmark paper in JAMA Dermatology confirmed that spontaneous splinter hemorrhages, particularly in multiple nails, are a recognized early sign of infective endocarditis, an infection of the heart valves, one of the most underdiagnosed cardiac emergencies in adults over 65. If you see this on multiple nails without having injured your hands, do not wait. This is not a YouTube diagnosis moment. This is a call your doctor today moment. If this video is giving you something your last 3 doctor appointments did not, tap subscribe. Not for this channel. For the next time your body sends a signal that nobody around you knows how to read. That is what this channel exists for. Sign number 7, Bow's lines. Horizontal grooves running across the nail. Not vertical ridges, those are common with aging. Horizontal, like a groove pressed across the entire width of the nail. Here is what Bow's lines are telling you. Nail growth stopped temporarily at some point in the past, and then restarted. The groove marks exactly when. The mechanism here is any severe systemic stress, a heart attack, a major infection, a surgical event, a period of extreme malnutrition, can temporarily halt nail matrix activity. When growth resumes, the nail grows forward, but the groove remains. The Mayo Clinic's 2011 review of nail changes in older adults identified Bow's lines as markers of past systemic shock, including unrecognized cardiac events. Unrecognized, meaning the heart event happened. The person recovered and never knew. The nail remembers. If you have a horizontal groove across multiple nails, and you cannot explain it with a recent illness you know about. That groove deserves a conversation. I want to tell you about Dorothy. 74 years old, retired librarian, sharp as anyone I have ever read about in this research. For 14 months, Dorothy noticed her nails were changing. Whitening, losing their pink, going almost entirely pale from base to tip. She mentioned it once at a routine appointment. Her doctor said probably just aging, maybe circulation, nothing to worry about. Dorothy went home and worried anyway. Her daughter, a registered nurse, visited that Christmas. She looked at Dorothy's hands across the dinner table and went quiet. She recognized the pattern immediately. Terry's nails. Dorothy was referred, tested, scanned. Early-stage liver disease, caught before it had progressed to cirrhosis. Her gastroenterologist told her, had this gone undetected another year, the conversation would have been very different. Dorothy still walks her neighborhood every morning. Unaided. At 74. Because someone looked at her nails and knew what they were seeing. Now you do too. Now here is something most videos like this never give you. Not just the signs, but what to actually do starting tonight. I am calling this the Keratin Mirror Protocol. 5 steps, no equipment, no expensive supplements, everything from your kitchen or your grocery store under $5 a month. Step 1, the 2-minute nail audit. Once a week in good natural light, examine all 10 nails. You are checking for color change, surface change, shape change, and any lines, horizontal or vertical, that were not there before. Take a photo on your phone. Date it. This gives you a visual record that your doctor can actually use. Step 2, the iron-vitamin C pairing. If you see spoon-shaped nails or general nail brittleness, the most evidence-backed grocery store correction is this. 1 serving of cooked lentils or black beans daily, paired with a vitamin C food source at the same meal. A squeeze of lemon, a small orange, half a cup of tomatoes. Why the pairings? Vitamin C converts non-heme iron, the plant-based kind, into a form your body can actually absorb. Without it, the iron passes through. With it, absorption increases by up to 3 times. Cost per serving, dry lentils under 30 cents. Step 3, the protein foundation. Nail keratin is protein. If your nails are brittle, thin, or growing slowly, your body may be in what researchers call anabolic resistance, meaning your muscles and tissues have become less efficient at using the protein you eat. The correction, confirmed by Harvard Medical School research on adults over 60, is not eating more protein overall. It is timing. 30 grams of protein within the first hour of waking. 2 eggs, a cup of Greek yogurt, a small can of sardines. This resets the anabolic window that most seniors are accidentally closing every morning. Step 4, the hydration reset. Blood viscosity, the thickness of your blood, increases overnight. In the morning, your capillary circulation, including the tiny vessels feeding your nail bed, is at its most sluggish. 1 full glass of warm water before coffee, before anything else, within 5 minutes of waking, begins thinning that viscous overnight blood. Think of it as flushing the pipes before you ask them to work. Cost $0. Step 5, the doctor conversation trigger list. Take this list to your next appointment, or call before then if you see any of these. You have the right to name what you're seeing and ask for it to be investigated, not dismissed. Just say this: I have been noticing changes in my nails. I would like to rule out systemic causes, specifically liver, kidney, and cardiac markers. Can we run a panel? That single sentence, said clearly, changes the dynamic of that appointment. Who should avoid self-treating? If your nails show splinter hemorrhages on multiple fingers, do not self-treat. Call your doctor today. If you have known kidney disease, do not increase iron intake without medical guidance. If you are on blood thinners, warfarin, Eliquis, aspirin regimens, consult before adding any supplementation. If you are in active cancer treatment, nail changes during treatment are common and require specialist evaluation, not kitchen protocols. Here is what you do with everything you just learned. Tonight, before you go to bed, go to a window or a lamp. Look at your nails. All 10. You are not diagnosing yourself. You are reading the mirror your body has been holding up, possibly for months. Take a photo, date it, save it. If you see splinter hemorrhages on multiple nails, do not wait until morning. That is a call tonight. Or an urgent care visit. Tomorrow mornings. Before coffee, 1 glass of warm water. Within the first hour, 30 grams of protein. And if you have lentils in the pantry, soak them tonight. Tomorrow's lunch just became part of your protocol. Red flags: seek medical attention immediately if you see new splinter hemorrhages on multiple nails without any hand injury. Digital clubbing appearing alongside shortness of breath or chest discomfort. Blue or gray nail discoloration anywhere on the hand. A rapidly changing dark band running the length of any nail, melanoma must be ruled out. Painful swelling at the nail fold with any sign of infection. These are not YouTube moments. These are emergency room moments. I am not saying every nail change is a crisis. I am not saying dismiss your doctor. What I am saying is, you have the right to look at your own hands and ask the right questions. That is not paranoia. That is sovereignty. A note before I go. This is educational information, not personal medical advice. Your situation is specific to you. This video is a starting point for a real conversation with your physician, not a replacement for one. That is not a nail check. That is you taking back the diagnostic conversation. Share this with the person in your life who keeps being told their nail changes are just aging. Because the body has been sending the message. Someone just needs to know how to read it.